shove it into the latest technology, have a future-proof architecture. And that's not how it works.
Welcome to Unlocking Big Data, a series about getting trusted data to healthcare professionals, presented by HIMSS. HIMSS Market Insights conducted research on data analytics platforms in December 2022 to early January 2023 to understand satisfaction with current analytics platforms or solutions, integration of applications and technologies with data analytics platforms, challenges encountered with investments in analytic platforms and upgrades, and reliability and use of analytics data. 55 executives, IT, technology, and clinicians participated in the research. Throughout the series, we'll present key data points from the research and focus on why these data points are important and how you can leverage these findings to support your healthcare organization's data initiatives. In our second episode, we'll look at overcoming analytics platform investment challenges. I'm joined by Tina Esposito, System Vice President and Chief Health Information Officer at Advocate Health, and Nick Stepro, Chief Product and Technology Officer at Arcadia, who will help us unpack key takeaways from the research. Welcome, Tina and Nick.
Great to be here.
If many do agree that data accuracy and access are critical to their healthcare organization's success, how do they overcome the significant challenges of competing strategic priorities, and in particular, lack of staff resources to implement and train for new technologies?
I think it starts by narrowing your focus, right? I think there's a huge appetite to do a heck of a lot with all of the data that we can capture out of the exhaust of every healthcare interaction, and it's seemingly infinite possibilities. And I think where a lot of organizations can fail is taking too big of a bite at first. I've had dozens of conversations with health systems across the country, and I've seen so many pitch decks where someone puts, an architecture diagram in front of me, and they think that they can capture every possible piece of information across the healthcare ecosystem, shove it into the latest technology, have a future-proof architecture. And that's not how it works. And the result is millions of dollars of losses, a ton of burnout of staff, failed projects. So I think some of the best guidance is keep it small to start, pick a focus, have some small wins and some big bets and blend them so you get a little bit of momentum early, but you're still anchored on some of the biggest transformational outcomes as an organization.
I agree. What I would add a little bit is, as we think about an organization and its maturity to being data-driven, one of the things that I think becomes very important is that analytics is not a priority or a specific strategy. It really is a strategy enabler. And so I think when an organization starts thinking that way, it's less about, do we do the analytics platform or do we do strategic priority number 3? It really is, you have to do analytics and build some foundational wins, as Nick just talked a little bit about, in order for you to realize those strategies. And so as the organization matures, it's less of that type of conversation and more about how do we keep building our analytics strategy so that we can do more from a strategic perspective.
I think it's great. It's very much like it becomes a public utility model to some extent, right? It's like you can't operate without the internet. If you're a healthcare organization that wants to be relevant in the next 10 years, it's that and,
Absolutely.
Right?
Data should be ubiquitous.
Exactly.
And how do you do it in that way? And analytics should be available to those that need it and desire it, either strategically or operationally.
So how do you leverage data inaccuracy as negatively and significantly impacting the healthcare organization from a business and operational perspective and a clinical perspective? What are some use cases to present?
Well, what's been interesting that I've seen or witnessed I would say is that when you see a data inaccuracy, what that typically tells you is that, and you start digging, is there some process or workflow that just isn't working. And it's less about the data being inaccurate and the realization that we have processes that aren't working. And so we have used it to really highlight that, to put that front and center, to say, we want good data or want to use this information in a way to make decisions, but actually we can't at this point until we fix whatever underlying issue is. And sometimes in the clinical or operational world, that's a big deal. And so fixing that becomes much more of a priority in the focus, as opposed to the data is not accurate. Obviously, that depends on what the data we're talking about is, but in my experience, it really always goes back down to some workflow or process that isn't working.
I think that's so insightful. Turning the problem statement to a reflection of the upstream processes that it drives, the inaccuracy of information in and of itself is a business problem that has other cascading impacts beyond just the inaccuracy of the data itself. And I think there's huge opportunities to improve those upstream processes based on that reflection if you take that mindset. I would also add that we should be we should be a little more strategic about our thresholds and fault tolerances of data inaccuracy, right? You alluded to some clinical applications where inaccurate information can lead to disastrous outcomes, right? That very much exist. But there's a heck of a lot of other applications of data analytics where directional insights are sufficient. And I think if we can, as leaders in the analytics and the data space, help coach business leaders to understand those fault tolerances and the applications of data and where you need perfection versus where you need good enough, I think we can move a lot faster as an industry.
Yeah, that's absolutely true. I think don't shoot the messenger and ensure. And I, as a data person, I grew up with that, carrying that a little bit. And I agree. I think in an organization that wants to use data in that way, if you shoot the messenger, then that sort of hinders all of the data and ensuring that you're leveraging it to make more objective decisions. So you're absolutely right. I think in certain aspects or realms, directional's got to be good enough. Understanding what that might need to be, of course, is also just as important. So excellent point.
So for many in IT, and especially in healthcare, change is difficult. It's understandable to face clinician and analyst resistance in adopting new solutions because they're going to impact existing workflows. How do you overcome that particular resistance?
I think it starts with designing with empathy and meeting each other where we're at. So there's, I've observed, I'm sure you have over your career, there's really like antagonism between technologists and clinicians for some reason when we're both actually anchored on the same outcome. You have like the sort of prototypical provider who sees a bunch of coders in a closet that don't understand patient workflows and are just forcing technology for technology's sake. Then you've got the prototypical coder who thinks that the providers are these obstinate Luddites that are just not going to adopt any sort of technology despite the promise of it. And obviously both of those are completely unfair, right? These are both critical parts to the healthcare infrastructure, all anchored on improving outcomes, reducing cost of care, doing well by their patients. And I think the more we can try to bridge those gaps and design solutions that appropriately meet both teams in the middle, the more we're going to succeed as an industry.
Absolutely. And I think it's ensuring everyone's at the table. Mm-hmm. Context can be divisive. Your goal is to make it decisive. So get everyone at the table and talk a little bit more and get to a consensus on what's the problem. Is it a problem? Why is it a problem? And what will fix that problem? And if everyone's at the table, I know that sounds very Pollyanna, very sort of change management 101, but we have found if you don't incorporate that, then it could be the best solution ever, but no one really buys into it. So yeah, agree, get at the table and talk about the problem and just make sure everyone agrees it's a problem to fix.
And to pile on, not only talk about the problem, but quantify the problem, right? And take a small bite at that problem and create an outcome that is measurable, right? So I think sometimes we come to these conversations, we're going to change everything, transform healthcare. Maybe start small. We can get 1,000 additional patients their vaccine this year, right? Do we agree that's a good idea? Yes, we agree. How many extra clicks does it take to do so? One extra click, an extra 5 minutes here, an extra 10 minutes there. Is the cost worth that outcome? And if you can quantify that, then you can anchor on pursuing it. And importantly, you can measure it. Because at the end of the day, none of it matters unless it works, right? And the best way to drive adoption is to demonstrate that the way you set out to pursue actually worked, right? And build on that win.
And I would add too, when we measure success, it's about improving the outcome, more vaccines, the right people are getting the vaccines, but it's also, did we make the life of the clinician easier? In a clinical setting, obviously, depending upon operationally what you're focused in on. So were there less clicks? Was it easier to get to the screen, the need, whatever it might be? Is it a better place or a better process than it was before? Less time, does it take less time now than it did prior to that? That's true success. And I think that's how you win over those that might have issue or take issue with change, if you will.
And that's all we have time for today. Great discussion. I want to thank our guests, Tina Esposito and Nick Stepro, for their perspectives. And be sure to check out the other episodes in this series, as well as our companion podcast. For HIMSS, this is Michael Krieger.